from an infrastructure standpoint, there's incentives, and how do you look at the incentives in terms of reimbursing for care, paying for care. As you may know about the Affordable Care Act, there's a movement now with access, so a lot more people have access to health care. But now we have to think about the cost of health care and how we're going to bend the cost curve in the United States because it's growing rapidly. So I think with the use of technology and empowering patients and consumers differently, we can change the dialogue. I think technology is a great opportunity to do that, but we have to look at data. We have to understand what the data means, because data in and of itself doesn't really get you the value that you need. We also have to think about privacy and how you manage all of this new data about oneself. And I think that's not just for healthcare. That's me moving around with my mobile phone and people knowing my exact location wherever I might be. So I think we all have to think a little bit more about what all of this new visible information about us means, but if we can really harness it and think about the value for it in a healthcare transaction, I think that's the great new opportunity that we have. There's a concept called digital divide, and when you think about technology and who has it, you don't want to suddenly provide better opportunity to those who can afford it versus those who can't. And so it's something that we've always been mindful of in the healthcare systems that I've worked, in terms of anything that we create should be equally available to anybody. But that being said, and sometimes that meant using not the greatest technology to make sure it was ubiquitous access across these patient groups. But even within that framework, I think it goes beyond technology. It goes more towards certain motivations of different patient groups. It goes towards literacy and other, sometimes societal issues. It depends on who you're targeting. And I think technology is a means to an end. But in order to truly create a better human interaction, which is what healthcare ultimately is, you need to understand who the human beings are entering that space with or without that technology.